Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 164, and you're gonna have to bear with me a little bit today. I woke up at 4 o'clock this morning, had a big day of training at the clinic with staff. It is later in the day on that Friday, and I really wanted to get this vlog taken care of so we could have it ready to post on Sunday morning. Now, if you have not done this already, do me a favor, click the like button, really helps out the channel, and as well as hitting the subscribe button with notification bell so you get notified every single time I publish a new video. Now, a little bit of a recap of the last 2 weeks. You may have noticed that the Dr. Cliff live show actually went live on Facebook Live this week. I don't think we had luck going on YouTube Live, unfortunately, so we still have a few kinks to iron out. What we think is going on is that YouTube and Facebook are starting to crack down on heavy streaming onto their platforms. And even though we're not like a big professional news organization or anything like that, we do have a pretty long stream that is putting through a lot of data. And I think that maybe Facebook and YouTube are restricting that because they're trying to keep their channels for smaller creators, I think. We'll see. I don't know if we're going to get this all sorted out. We really need the show to be live. I've explained all this stuff already. You can go back to the last 2 vlogs, number 162, number 163, if you want to learn more about the issues that we're having. But as of right now, we've got 3 more weeks to see if we can figure out a solution to get the Dr. Cliff live show or Dr. Cliff show live back on track. With that said, the main thing that I want to talk about today, you guys hear me talk a lot about best practices. Now, best practices are these procedures that must be followed in order for you to achieve the highest level of success with your hearing aids. But the main discussion that we had today, while we did talk about best practices inside of today's training with everyone, all staff members, we really started going into this aspect of how we administer best practices and how we show value to our patients and help them understand that this is how they hear their best when we follow these procedures. And it has a lot more to do with how we include them in the treatment process. We actually have a term inside the field of audiology. There's actually a term that's more global than just audiology, which is called person-centered care. This is when you pay attention to the wants, needs, and values of your patients, and then you include them in the decision-making process. So for instance, when we have a patient come in for a consultation inside of the clinic, there are certain best practices that need to be followed during that consultation in terms of what information you're getting from the patient, in terms of red flag information that would lead us to refer them to a medical professional to get that taken care of. There's also certain tests that we need to be able to perform on them: air and bone conduction, pure tone air conduction, speech testing, speech and noise testing. Those are all important things that we need to be able to do from a hearing test perspective, and then also reviewing different options with the patients and help educating them on what the best option would be, and considering all the options, not just, pinholing someone into or pigeonholing someone into one particular type of treatment. But the thing that I don't, again, talk a lot about on my channel is the way in which we administer following these best practices to make a patient understand how valuable they are and how they ultimately will impact their overall treatment outcome. So today was a very long day of us going in and explaining, okay, these are what best practices are, these are how we administer them, and these are the types of things that we need to say to our patients to help them understand what we're actually doing. Because I talk to a lot of hearing care professionals out there all the time, and they say, Cliff, following best practices is great, but my patients have no understanding if I actually did a procedure or what procedure needs to be done. And I'm like, well, a lot of it is because we're not doing a good job explaining what we're doing and including our patients into the treatment process and the decision-making process. I think all of this is incredibly important. And I just think that collectively as a profession, we're not doing a good job of demonstrating this value. Now, I know that I have the Hearing Up provider network. The criteria for that is that you follow best practices. But what I do not dictate is how those best practices are administered. There are a variety of different ways that you can actually administer best practices, and it really comes down to whether or not the provider that you go see is going to do this in a way that you can actually understand what's going on, so you know that you're achieving the highest level of treatment success possible. Now, I get a lot of criticism from certain people who are very challenging, let's say, towards my promotion of best practices. I happen to think that best practices, from a foundational standpoint, is where everything needs to start. Now, if you know my history at all, you know that I was a Marine Corps Scout Sniper, and when I was a Marine Corps Scout Sniper, the two things that we really valued was this idea of following the fundamentals and doing it with extreme precision. I view audiology in the same way. There's certain fundamentals that we have to follow. Those fundamentals are best practices, and we have to do it with a high level of precision. So if you get really lackadaisical with how you administer best practices, you don't achieve the highest level outcome for your patients. So we spent a lot of time talking about this conceptually inside of the clinic. Now, I've had, so two of our audiologists, I would say one of them is an audiology extern, Kelsey. Dr. Leslie Balderas was my extern a year ago. So they spent a lot of time interacting with me and seeing how I actually administered, from a treatment perspective, best practices. And Dr. Rachel Cook, she had come in from outside organizations. You know, she had some more experience under her belt. She's been an audiologist longer than Dr. Balderas, but she had not been inundated with the process of how to apply these best practices in the best way possible. And so we've been spending a lot of time with her since she's come onto the team to really make sure that she understands that, hey, these are what best practices are, and this is how we administer them to give patients excellent outcomes inside of our clinic. And so we just kind of took that theme and we used it in our training today. And so it was a very productive day explaining all of these different things that we do. This is how we should be doing them. This is the reason why we do them, so patients can understand what's actually going on inside of the treatment room. Now, I spent a lot of time this week really systematizing everything. I think one thing that's going to end up coming out of all this training that we do inside of the clinic is that I'm going to create these different systems and protocols and different sound bites that providers should be using to convey the proper information to their patients. I think I'm probably going to create an entire training program for all audiologists to use. And I'll probably, I mean, my wife would kill me for saying this, I'd like to make it open source where I share this information, they can use it, they can not use it, but you know, just have access to it. And the reason why I would tend to want to make it open source is because that has the highest likelihood of improving patient outcomes from a treatment perspective, even if patients do not come to my clinic. Because really, at the end of the day, what I want is for individuals with hearing loss to receive the highest level of care possible. And I am one clinic in one state, in one city, and only so many people can come in, and we have limitations. I mean, there's only so many open time slots per week that we can see patients. And there are millions of people throughout the United States, and then of course internationally, because people fly in from out of the country to get treatment. There's a lot of people who need help, and we're just limited on what we can do inside of our own clinic. We've been fortunate enough to have a lot of patients who understand the value of what we're trying to do inside of our clinic and how we're different from pretty much everybody else out there. It's because we take the time to do the things the right way, follow best practices, and do it in a way where they're included in the entire process. And a lot of people who come from other clinics, a lot of patients who come from other clinics are like, whoa, this is like totally different than anything I've ever experienced before. And one thing that we trained on today was like, well, how do we help individuals who call the clinic to understand that things are totally different inside of our clinic than other clinics? And it's very hard to convey that information very quickly over the phone. And, you know, to be fair, the front office staff inside of our clinic, while they're phenomenal, they don't know all the fine details and nuances of performing really high-level treatment back in a treatment room. So a lot of today was spent, you know, going through different case studies, different, individuals and hearing losses that we've had come into the clinic, and then myself and the other providers in the clinic were starting to do some critical thinking skills, and like, how would we go about doing an assessment and treatment for this particular individual? And we had our front office staff there, so they really, I think this was the first time that they really got to sit back and see like what we actually do, what the hamster on the wheel inside of our heads is actually doing when we're trying to come up with a treatment plan for someone who has a difficult to treat hearing loss. Because if we're going to be honest, the platform that I have on YouTube attracts individuals who have hearing losses that have been unsuccessfully treated at many other clinics that are out there, and we're basically their last shot. Yes, we do get some more standard hearing losses, which can be a little easier to treat, so to speak, but we get a lot of difficult ones, and a lot of the case studies that we looked at today were very difficult cases that requires a lot of critical thinking to work through to get treated successfully. And I say this to everybody, it's like, we can't get you to hear perfect, but our job is not to get you to hear perfect. Our job is to get you to hear the best that you can possibly hear, and the way that we know that we're doing that is that we follow best practices to a T. We never cut corners. We verify and validate everything that we do, so we know that by the time we're done with someone in their fitting sequence, we have them performing at the best level that they can possibly perform. Now, that doesn't mean that we don't dig even further than that in their follow-up care visits. We just went live on the Dr. Cliff Show this past week, talking about certain case studies that we were working with, and there was one of them had been my patient for like 4 years, and 4 years into their treatment, I ended up digging and finding out something else that they were struggling with that they didn't verbalize to me, but it took me digging in to figure out if there was anything else, anything potentially that was going wrong that I could fix. And so I started talking about different situations that they're in, and identifying how's that working when you're in this situation. And they ended up saying, well, it's good, but I can't use my telecoil in this public venue because then when someone leans over to me and starts talking to me, I can't hear and understand them. And that is a simple fix for me in the programming software to activate the microphones when you're using telecoil. But it had just never come up. And, potentially it would have come up years ago if I would have continued to dig even further at that period of time. But there'll probably be other things that I dig out of that patient as time goes by as well. Now, I don't want to digress here. Really what I wanted to convey in this video is that best practices are a must. There is never a good excuse not to have best practices done unless you literally cannot afford it and you go someplace that gives you either, charity devices or really low cost devices and low cost of treatment. And as long as you're aware that best practices are not included in that. The other thing on top of best practices is person-centered care. Just because you do best practices doesn't mean that you should omit doing it in a manner that is person-centered. And you should be included in the entire treatment process. You should understand, or at least have your provider to attempt to help you understand what they're actually doing, why they're doing it, what potential limitations are, what potential trade-offs are in different types of treatments or different approaches in treatment, so you can ultimately know at the end of the day that if you're doing well in situations, and if you're not doing well, why you might not be doing well in those situations, because everything has a reason. You just have to figure out what it is, and that is literally what you pay your hearing care professional to do. So, it's one of those things where you typically get what you pay for, and sometimes you pay for more than what you actually get, which is not a good thing. Sometimes you don't pay as much for what you actually get, which is a great thing, but in most cases, you get what you pay for. And that's been a theme, not just in hearing care, it's a theme anywhere, and you probably know it yourself. But that's really what I wanted to get out there today. I'm really proud of the staff for all the time and effort and energy that they put in to today's session, because it was exhausting. It was, I woke up at 4 this morning. I was there by 6:30. Staff arrived at 7. We basically went straight through lunch, had a quick lunch, got back to training, and now here we are on the weekend. So just kudos to the staff, because we do this. We shut down clinic for an entire day, which is, from a revenue standpoint inside of a clinic, is a big deal. But to shut down a clinic, and we do this a couple times a year, and we have other morning, type meetings where we block off time that we don't see patients. But we kind of have to do that in order to make sure that we are on top of our game. I've spent more time training with staff in this last year and a half than I've ever witnessed combined in any other clinics that I've ever worked at or did clinical rotations through. And while it is a significant time and monetary commitment to do so, I feel that it's worth it because you know what? You guys are worth it. And again, just super proud that we have the privilege of doing so inside of our clinic. But that is all I really wanted to talk about today, guys. Keep your fingers crossed with the Dr. Cliff Show. Make sure that you give this video a like if you want us to continue on with the Dr. Cliff Show. I'm probably going to try to figure out a way to make sure that we continue to do those types of podcasts, those video podcasts. But again, let me know in the comment section below, and I'll see you next week.